All right, guys, weeks 2 to 3 are in the books, and I gotta say, you guys knocked this one out of the park. We covered a lot of different material, so I just wanted to wrap up everything in this recap video and drive home a few take-home points at the end of it. Some of the topics we covered were we looked at the nervous system functions, specifically peripheral versus the central nervous system. And then we spent a lot of time looking at central sensitization versus neuropathic versus nociceptive-driven pain. Classifying people can be tough, but it helps us lead us at least down an appropriate path for treatment when looking at clinical decision making. We have to have some type of starting spot to know where to head with some of these patients. Right now in the announcement, I am uploading a chart I made about central sensitization. It looks at all the different traits that someone in a central sensitized state might present with, like hypersensitive to smell, hypersensitive to touch, hypersensitive to noise. And we're going to talk a lot about these kind of in the upcoming weeks too. But we're learning with these patients that we really want to try to minimize nervous system input. So they might not be the best patients necessary for manual therapy. They might not be the best patients to be treated in a loud, noisy clinic looking up at fluorescent lights. So the chart just kind of outlines some of the things that these patients are susceptible to and how we can address the majority of these in the clinic. We then moved on to metaphors for central sensitization, and metaphors are super, super important. So we're going to be hitting on these a lot through the rest of the course. Our metaphors covered everything from floods to cars to buying a Lamborghini on a PT salary. That was fun to see because it's fun to see metaphors be so different and so widespread. And it's important that to have a bunch of different metaphors with a bunch of different topics because every patient is different. So they're a great way to explain all different topics related to the science of pain. So we're going to be touching back on metaphors a lot. Some take-home points from these couple weeks are trying to classify pain can help with creating a treatment plan based off a sound clinical reasoning model. However, don't forget that pain is weird, so we need to stay open-minded with our patients. Looking closer at central sensitization, weird widespread symptoms with no specific mechanism of injury isn't always central sensitization, right? We need to remember sometimes it's tough as we learn more about pain and central sensitization and kind of these widespread, no specific mechanisms of injury type presentations. We need to remember that there are bad things out there, and we need to make sure that we're doing our due diligence in ruling out these non-musculoskeletal pathologies. And then to bring it all home, metaphors, metaphors, metaphors. Have a bunch related to a bunch of different topics and make them personal to the patient. This is where our subjective exam becomes crucial. Every subjective exam, I think, should have some type of information about what that patient likes to do for fun. What do they enjoy doing? What are their main goals to get back to? Because if we can learn more about that patient themselves, then we can make our metaphors as personal as possible. And I think it'll just increase the success rate of learning all this material. So as always, reach out to me with any questions about this week's, and then we're moving on to week 4, which should be pretty exciting stuff. All right, thanks guys.